So our primary focus is to actually identify the cells where HIV is hiding during effective anti-HIV therapy in patients. Patients who initiate anti-HIV therapy have to stay on this therapy for the rest of their life because the virus does hide in cells, and if the therapy is stopped, the virus can come right back and cause a very large and deadly infection. So we are really trying to pinpoint where is this virus hiding and in what cells and in what tissues of patients. If we can actually identify patients who are in an acute infection phase or early infection phase, then they should really initiate anti-HIV therapy immediately. Then hopefully the amount of hidden virus in their cells is much lower. And then we can actually hopefully clear this virus from these cells using new therapies that are now being developed.
Our research has been studying ovarian cancer, mainly try to understand why ovarian cancer become resistant to chemotherapy. We focus on the resistance because resistance to chemotherapy is a main challenge in ovarian cancer, and there's very few targeted treatment for ovarian cancer currently. And the paper we published in Oncogene, and basically we actually continuation of the work. A new gene we actually discovered in our lab called ANCHORED1. We discovered this gene's high expression is associated with poor survival.
In this particular study, we found that this enzyme, sphingosine kinase, or particularly one form of it, sphingosine kinase 2, is required for the optimal development of leukemia. So if we delete or inhibit that enzyme, animals are less likely to develop leukemia. And if we inhibit that enzyme in patient cells, the cells will die. And of particular interest, it actually works in synergy with some of the current agents that are used to treat leukemia, particularly some of the targeted therapies that are just entered use and are in development.
We use this brand new novel cutting-edge technique called connectomics, and connectomics is essentially a technique which allows mapping different connections in the brain. Connectomics essentially captures the connections between all these different regions, and for the first time allows us to understand the brain from an interconnected complex system perspective. For the first time, we provide evidence that the clinical symptoms seen with depression actually have a structural basis. And the second implication is it provides new ways to develop novel therapies and treatment regimes. Now that we've provided evidence of specific regions and structural networks in the brain which are altered, new therapies could be actually targeted towards treating or activating these regions and connections, and in essential reset the wiring networks in the brain.